Listen, education and politics. You need to know more about them. Entertainment and these things. You need to know more about them.
Give it up for Tegan.
Oh, no, no. Yeah. Listen, education and politics.
Public health in Africa. Why does it matter? Pandemics, epidemics, Ebola, Zika, COVID-19. Africa has faced tremendous public health occurrences over the past couple of years. 48% of Africans do not have access to good quality health when they need it. The health systems in Africa is in dire need of great attention. With the rise of diseases like neglected tropical diseases, with the rise of non-communicable diseases as well, there's so much going on. From cholera, tuberculosis, to cancer, each and every single day, individual health is at risk. Community health is at risk as well, and even population health. Then when you add brain drain to it and realize that so many health professionals are leaving Africa at a very alarming rate, even as a continent, we do not trust our health systems. That is why so many of us are looking at other countries to seek greater attention when it comes to health. The rising population in Africa requires us to pay close attention to our health, because regardless of where you live, regardless of your background, regardless of your education, you should have good quality health. Health that is universal, health that is sustainable, health that is accessible, but also health that is fair. Health is a human right. We need health to be able to go to school. We need health to be able to aspire and dream. We also need good health to participate in the economy. Let's have a conversation to ensure that every African woman can have a solid child delivery process. Let's have a conversation regarding how Africa can be resilient for the next pandemic or epidemic. Let's have a conversation so that women between the ages of 15 to 49 can be free of anemia. Let's have a conversation as to how STDs and STIs can be prevented on a daily basis. But we also need to realize that when it comes to health, it is a collective effort. We must prioritize our individual health. We must put our health at the center, but also governments and private sector must play a huge role in realizing the dream of the African vision. Let's keep the conversation going. It is time for our GabFest panel. To my right is Bimbo Aderibibe.
Yes.
Bimbo, nice to have you.
Yeah, thank you very much.
You're an administrative professional at a primary healthcare center in Surulere.
Yeah.
And to my left is Dr. Isaiah Oluwatosin. You are a general practitioner.
Thank you very much.
Great to have you both on our GabFest panel.
Thank you.
Good to be here.
Let's get started.
Yeah, great to be here.
First topical issue, the rise of the Brazilian butt lift in Africa. What is going on? Do our women not embrace their bodies these days? Why is this such a huge deal right now?
Okay, so here's my perspective, right? The society has identified what is acceptable, what is trending, what is proper. These days we have the society defining all these things, for women, for men, for children. And because of the need for women to be identified as being proper or as being the having the perfect body, having the perfect shape, being the perfect person, there's just that need for the need to be perfect in your body, in almost everything, So women just want to have their bodies shaped, have their bodies adjusted, have their bodies just because they want to have that perfect body, and then they want to look perfect. They want to be that perfect Barbie girl. They want to be acceptable. They want, wherever they go into, they want heads to turn. They want to be the most desirable. So there's so many needs, from the woman's perspective that makes her want to just be that perfect, woman.
There's also social media. Dr. Isaiah.
So to add to that, I'll be taking up from where she left off, and it's more like saying the society has a way of pressuring people directly or indirectly, and the way people respond to these pressures are way different. There's this video that was trending one time. It says the pressure is getting worse, right? So the way people respond to these pressures are very different. So to some people, their own response is to cower into that pressure and then make modifications to their body to make them more, should I say, admirable, more attractive, or acceptable, as the case may be. But then that's going to be the case if everything goes on well, right? Because looking at it, there are quite a lot of things that can go right or wrong. But then let's not begin to go into that right now. But I think it has to do with a lot of pressure that people have different ways of handling.
I think also social media plays a huge role because now you're on your phone, you see all the celebrities from Kim K to who knows who,
having the figure 8, so that pressure
with the latest bags and everything, and you're like, I want to have this.
Yes, I want to have that. I want to be like that. I want to look like that.
Even if it's a bad job that you'll eventually get done.
Even if it's a bad job.
Second topic to discuss. Okay, so there's a move to decriminalize sex work across Africa. We've seen that with South Africa. Do we think that other countries are going to follow through and decriminalize sex work? The reason for this is that most advocates believe that you can actually tackle sexual violence, gender-based violence for sex workers when it is decriminalized. Can this happen?
Well, I, to an extent, agree with what you said. Looking at what's happening in South Africa, they're making a move to decriminalize it because they feel like a lot of things happen in the background because people are pushed to do these activities even in criminalized environments. Like they do it in secret. So because of that, there's a lot of violence that goes on. There's a lot of unreported abuse because who do you report to in the first place? If you go to the police, they're going to put cuffs on your hands and things like that. So they want to decriminalize it so that people can have a more free society to do their trade. But then does it apply or can it apply to every other African society? That may not hold entirely true. Looking at Nigeria, for example, I don't see that happening. And well, let me not put in my personal opinion right there.
Bimba, what do you think? Do you think that's the new thing?
Okay, so I don't think so. I don't think Nigeria should go in the direction that South Africa is going right now. And the reason is because, you see, even now that is not legalized, we have them almost all up in our faces. We have the activities going on, you can see. So imagine if it is legalized now, it's going to become worse. The situation is going to become worse, in my opinion. I think so.
I totally agree.
I think it's a slippery slope because I do get what you're saying, but I also feel that when some, participants of, I don't use the word prostitution, but let's just say that, are involved in that, there's a need for them to speak up, especially when they have violence against them. So how do you then encourage people to speak up on something that's illegal? That's where, it gets a bit, tricky. There's more of our Gap Fest panel. We'll be right back.
Okay.
On Tegan, we have our Gap Fest panel. Bimbo, Dr. Isaiah, why is it important to talk about health every day?
It is important to talk about health every day because we need to be aware of our health, the status of our health. We need to be aware of what we need to do, what we need to avoid, what we need to prioritize to be able to prolong our lives and to be able to avoid, having to deal with some issues that could have been avoided. So it is very key that we talk about that.
It is generally said that health is wealth, and what you know cannot kill you. Maybe even if that is not entirely true, it is important we talk about our health because it puts this awareness in our faces. We know what to do when we have a need, we know the right places to run to, and we know the adequate measures we can take to improve our health and prolong life.
Keep the conversation going because on Tegan, you get important information to live your best life. Welcome back to our GabFest panel. I'm here with Bimbo and Dr. Isaiah. Let's keep on talking. Universal health coverage. So many African countries want to have everybody having health insurance, regardless of the age. Insurance that is very much inclusive, equal, equitable, and accessible. As two frontline practitioners, two frontline professionals, do you believe that countries can actually achieve universal health coverage across the continent, and what would it take to get to that point?
Okay, talking about universal health coverage, it really has to do with making health services available and accessible to everyone at every level in the community and at a cost that they can afford to maintain. Okay, so is it possible for every African society to actually attain universal health coverage? Well, I would say it's in bits. It's a work in progress. Okay, and looking at Nigeria, for example, we have the NHIS, which was changed in 2022 to NHIA, that is the National Health Insurance Authority, to help people, subsidize or minimize out-of-pocket payments to, cut costs and all. But as it is, as we speak right now, the number of people or the percentage of people that have subscribed to NHIS as we speak right now is still less than 10%. Now that's way less than 100,000 people in the country, and we are about 213 million people in Nigeria. So is it possible? Yes, it is possible. It's a possibility. In fact, that's why NHIS was there or is there in the first place. But it has to be an all-inclusive thing, and it's really going to take a long time before we get there. But is it possible? I'll say yes, it is possible.
Okay, yeah. So to add to what he has said, I know that the government is doing all in its bid to ensure that everybody has access to healthcare and all of that. But I have seen where individuals and organizations, that are not government, that are also putting in their best. So to say that yes, it's achievable with the government and individuals coming together to ensure that. So yes, it's possible.
Universal health coverage, achievable, but there are so many factors at play because I think once you do have that provision, it then falls down to different players as well. Yeah. So it's national, but then to the community level, how do you ensure that somebody even at the community knows what he or she can get from their provision?
Thank you very much. And that's where the place of education comes in, the place of private public partnership, the place of people even deciding to take up the initiative for themselves and by themselves to ensure that everybody comes under that umbrella of universal health coverage.
Before we go, one more question. Organ donation in Africa, and this is something that's very much on the horizon. Uganda has made it now legal to donate your organs with consent. So if you don't have consent for removal of your organs, the person doing that is in trouble. My question to you is, will more and more Africans register to be organ donors?
Okay, go ahead.
I know many people who would say no. That once they're done with this world, nothing gets removed.
Yeah.
All right. So, do I see many African countries following suit? Well, maybe not. I can't say yes. Yeah. But making it illegal for people to actually consent to donate their organs, there are good sides and bad sides, like many other things, right? There are good sides and bad sides, and it promises to alleviate a lot of suffering in terms of helping the sick, helping people
And
who
reducing
have
death.
terminal
Yeah.
illnesses, come out of their predicament
Yeah.
and live better lives. So there are good sides to it. However, the bad side, like I mentioned, is the fact that people can do it out of proportion because in no time you get to see things like in the Western world we hear people say they are transabled.
Yeah.
What this means is that they just choose to say today I have a leg or today I have a hand, and then they can cut off their leg and say I wish to cut off my leg because I want to feel like a disabled person. So if that is not regulated, if that is not kept in check, we can in no time cross that thin line between people legally donating their organs to becoming something else. So African countries following suit, well, not a big deal, but we must put it in check.
Yeah. To add to what he has said, to be able to curtail abuse, because if it is not properly regulated and properly checked, that abuse is bound to happen. So we have a lot of people going overboard, just to ensure that they get, and then they can also use the legal part to do the illegal part. Yes. So they come and ask you for consent, you give them, and then they do what they want to do.
And people are even scared of like ritualists, or sort of like
Yes,
the knives, so many
exactly.
things.
So many things, ritualists coming to get. It has to be properly regulated. Except we have policies and regulations that would really, put these things in
I
check.
feel like it's still on the horizon, but who knows? Maybe we'll be more advanced than we know. It's a few years down the road.
Maybe.
Bimbo, Dr. Isaiah, thank you for joining our
Thank
GapFest
you.
panel.
Thank you.
Keep on talking about health. Health is important.
Yeah.
Health is vital. And spread the word on why your health matters and why health should be prioritized.
Yeah.
We'll be right back. It's Tegan. We have a fantastic, amazing, extraordinary show for you. Who is the king or queen of Africa?
Hi, my name is Blessing Obasi. Keep watching the Tegan Show.
Hello there, my name is Damilola Ogunsi, also known as Eagle Fish.
Do we need hope? Or do we need hope and actually getting the job done? One place, one show, more fun, more dance, more laughs. It only happens on My guest cannot be here because he's on the path to recovery. You may know him from the song Jaga Jaga, the one and only Eedris Abdulkareem. Afrobeats, R&B, hip hop. Please welcome Eedris to our show. Eedris, gotta ask you, how are you doing?
I'm doing good. To God be the glory.
When did you know you weren't feeling so well?
Since like approximately about, let's say, 7 years ago, I've been feeling very funny about my right kidney. It has been giving me sign, but I've been so careless about it. I've been so ignorant about it. So when I finally went to the hospital, I was told that I have stage 4 kidney problem. So I had to register for dialysis, and when I registered for dialysis, I was going for dialysis. And my wife actually had to call a couple of our friends who also had kidney problems, and they advised her that we should go to St. Nicholas Hospital in Lagos to go and consult Dr. Bamboy. So we went to St. Nicholas Hospital, met with Dr. Bamboy, and he ran his own test, carried out a couple of series of tests, and he said that I'm sure you must have been told that you have stage 4 kidney problem, and the other thing you need to do right now is to get a kidney transplant.
Now talk about the conversation between you and your doctor.
So I now asked Dr. Bamboy if the hospital how to get a kidney transplant. And he said, no, 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 that I have to bring my own donor. I have to bring my own donor. It has to be from a family member, a brother, a sister, a mother, a father, a son, or a daughter, and it has to be 18 years to 65 years old. It could be any family member, anybody. So right there, my wife asked Dr. Bamboy if she can donate her kidney. And Dr. Bamboy said, yes, you can, if you are both compatible. So she asked, what are the things that she needs to do to know if you are compatible? She said, you have to carry out a couple of tests. And she said, can I start now? And Dr. Bamboy said, yes, why not? And he called the laboratory and we went to the laboratory. I was very shocked. She never told me anything. She was just a selfless and a got sent to me. So we went to the laboratory, the first, second, third, fourth, fifth, test, all compatible. Right there, right now, I knew God had planned for me and he knew why I married my wife. Maybe it was because of something like this that it felt that might happen in future. So I was so shocked. I was speechless. I didn't know what to say. Shocked. So right there, Dr. Bamboy now said that okay, so you guys are good to go, and that the transplants, that the surgeons will come in from London and from India and Canada.
On that very first day of your surgery, what was the experience like?
When they finally came in, Dr. Bamboy called us and said, hey, okay, so you guys can come in. So I did my last, what's it called, dialysis, maybe around around 11. We checked into the hospital in the evening around 4, and the doctors were around and they came to check me at night. And in the morning, they came to take my wife and around 9 o'clock, and they came to pick me around 10 o'clock. And as soon as I got to the theater, all I could remember was that I just lay down on the bed and I couldn't remember anything anymore. 5 hours later, it was the pain from my right abdomen that woke me up. So I was so dehydrated. I was so thirsty. So I was just saying, "Can I have some water? Can I have some water? Can you please give me some water? Take. Can I have some water, please?" And the nurses were like, "Sorry, we can't give you water till tomorrow." And when I checked the time from the wall, it was approximately 8:30 p.m. So I had to wait till morning. So I was just praying and thanking God that everything was okay. But the pain was very massive. So the doctor and the nurses kept coming to check, and the pain started going down. You know, so in the morning they gave me one to take, and I was like, "Where's my wife? I want to see my wife." And so they brought my wife on a wheel. So I was so happy to see her and knew that she was okay. I thank her and pray for her. It was a very emotional moment. It was a beautiful moment.
Your wife has been amazing throughout this process. Talk more about it.
God gave me a second chance through my wife to live again and to speak as the voice of the voiceless to those who can speak for themselves. So for me, it's a great gift. One, because some people stay for 10 years looking for donors, they never gotten anyone, and they just pass on like that. And for me, I didn't have to wait for years looking for a donor. My wife just saved the situation. So I was so grateful to God. I'm so grateful to my wife for making this happen. So it hasn't been really easy, to God be the glory.
How can we ensure that people can get transplants in Nigeria when they need it?
I think people need to be more compassionate. People need to understand that okay, with one kidney you can live. So if you have a family that is going through a kidney problem, you should be able to help that person by donating your kidney. You will not die if you give one of your kidney out. People live with one kidney and they survive and they're doing very, very well. I know it's not easy for you to just want to give out your kidney like that, but if you truly love humanity and you love your family, you should be able to do anything like that because you won't expect it. It takes also a friend from outside that is a brother, that is like a blood brother, to want to give you his or a kidney. Nobody will want to do that. It's crazy. It's a dicey situation. But I will encourage people to understand that, you can donate your kidney, one of your kidney, and you still live, because I understand why hospitals would not want to encourage to look for donors for people because if they do that, it's going to be as if they are encouraging organ harvesting, and which is not right at all. So this has to do with family. This has to do with individual. This has to do with humanity. For you to be able to get a donor. So I just encourage people out there not to be scared that with one kidney you can live, but you would have saved another life that might have just gone. You might save a life that might help you or your own children in future. So be strong and be hopeful and be human enough to try and understand that there's nothing wrong in donating your kidney.
Before we go, do you have any projects you're working on?
Okay, so I just dropped a new song to thank my wife for her selflessness, for her love, for giving me the opportunity to live again. Also use the song to thank everybody that supported me. Nigerians, home and abroad. I appreciate you all. May God bless you. The song is called Title Thank You. It's on YouTube and it's been played on TV, a couple of music TV stations. Just to appreciate everybody that came out to support me. I'm very grateful. It doesn't be easy, but I'm very, very grateful.
Eedris, thank you so much for sharing your story. We wish you a speedy and healthy recovery.
Thank you, Tegan. Thank you.
We dedicate a song just to thank you all. And I want you to know that I love you all. May the good Lord protect and bless you all.
This is the Tegan Show. Follow us on all our social media handles at Tegan Talk Show. Let's dance, let's have fun. Join the conversation today, only on Tegan. On the next Tegan, we have
Joel
and
K Solo.
A great Africa requires a healthy population. Today, we are looking into healthcare, talking with Dr. Ajayi Adewanola of King Trust Medical Center in Lagos, Nigeria, about the everyday challenges of healthcare, why it's important to put your health first, but also what the future holds for Nigeria and the rest of Africa. Join me. Hello. Hi, good afternoon. So I'm Tegan and I'm here to see Dr. Ajayi.
You're welcome, sir. Expecting you actually.
Okay.
So the first, second door on your right.
Second door to the right?
Yes, to the right.
Thank you so much.
You're welcome.
Hello, Dr. Ajayi.
Hello, bro. How you doing?
Fine. Good to see you again.
Yeah.
Awesome. Thank you. Dr. Ajayi,
Yes, sir.
You are big on healthcare. I am big on healthcare, and we believe that we can create a difference through healthcare.
Yes, sir.
We want to have an insight into a health facility in Nigeria, what the everyday life is about, but also the kinds of patients you see and the moments that make you feel more passionate about what you do. Do you mind showing us around?
All right, I'm glad to do that.
Okay, so this is your office?
Our consulting room.
Okay, consulting room?
Yes.
Okay.
It's where we see all our patients.
So from malaria,
Typhoid, appendix, pregnant women, arthritis, all kind of cases.
Okay. That is like what's the highest number of patients you've seen?
Like 50 patients.
Wow, a day.
So
Only doctor on ground, or you have other doctors as well?
I have other doctors working with me, PCCB doctors, I have a doctor, a night doctor on ground.
Wow.
We do the work together. Wow. There's a void in the health sector in Nigeria. So I would believe that giving my best in terms of being customer centric and making myself available to all my patients will go a long way in impacting people's life.
Okay.
Now, I'm not of the opinion of the JAPA principle. When everybody's going out of the country, yes, the health sector in Nigeria is not conducive. You know, the pay is bad, the environment is not okay. But for me, I believe that if I give in my best in those areas that are lacking, you know, we're able to help people, we're able to give the best of care, we're able to follow up after treatment, we're able to ensure that they have good health and they're happy, then Nigeria becomes a good place to receive healthcare.
Okay.
Yeah.
How did you get into healthcare? Was it like inspiration from your parents, from university?
Well, when I was leaving medical school, to have a hospital as a doctor, that was my main goal, to have a hospital in Lagos. So I pursued my vision and it happened. It took a while.
Yeah.
It wasn't easy, but it really happened.
Is there any rationale for who comes here versus downstairs, or?
No, there's no rationale. You know,
Okay.
once you can afford it, you come in and it give you the best of care.
Speaking of affordability, health insurance. How does that work? Do you have to have insurance to come into this space, or do you need to sort of like pay out of pocket all the time?
Health insurance, it has come to stay in Nigeria.
Okay.
So we have some health management organizations that we work in partnership with. So it's the same care.
Same cost regardless.
Same, yes. Not the same cost,
But same quality.
same quality, yes.
Regardless.
So, yeah.
So your theater, do you mind showing us quickly?
Yeah, here we have a theater, we're preparing for surgery.
Surgery, okay.
Alright, so this is where we do all our surgeries. Myomectomy, C-section, appendicitis, angiography, whatever surgeries you want to do, we do it here.
Power supply, electricity. How do you incorporate that into the surgery? Because you can't be operating on somebody and then lights go off. You know.
So what we do is before we commence surgery, we change to alternative power supply. We have 2 generators, we have 50 kVA.
Okay, so 2 gens.
And 10 kVA.
Okay.
So before we commence surgery, we switch away from NEPA.
Got it. So you're always guaranteed.
Yes, there's guaranteed. So prior to that, the generator is properly checked, the engine, the oil, properly serviced before we go ahead for any surgery. So that's what we do. So we do not rely on NEPA.
NEPA, got it.
For surgery.
If I go through other parts of Nigeria, other parts of Lagos, how often do I see facilities that are this well serviced, well functioning? You know?
Well, the truth of the matter is that they are very scarce. Even though they are available, they're very expensive, they're very scarce, but they are there.
Yeah.
But what makes a difference with my own practice is the fact that I am customer-based driven. I follow up on all my patients. I do not treat you and allow you to go. I want to know how you feel after discharge. I want to know your complaints after discharge, so I keep following up on you for as long as possible.
Wow.
That's my style of practice.
So it's more personal.
It's more personal.
More intimate.
Yeah, it's more intimate.
Got it.
Once you take care of your patient, or you treat a patient, it doesn't end at that point. You're supposed to find out what's the well-being of this patient after discharge. You understand? You could just leave the patient alone and say, okay, or you've paid for a particular surgery that's been done. Yes, it was successfully done. She's fine. She took her medications. We gave her post-medications to go home. And when she gets home, then that's all. No.
Prevention, treatment, and now follow-up.
Yes.
Okay.
Follow-up is lacking. Most doctors believe that once they've treated someone, they are done. It's ended there. No, it doesn't end there. You need to continue to check up on the patient. How are you doing? The patient might develop some problems after the surgery, after the treatment. And if you don't follow up, how will you know? The person will go elsewhere. So let me take you to the laboratory. Lab, yeah.
Okay.
So laboratory is a place to run tests.
Run tests, okay.
Blood tests, urine tests, tissue tests, scans, x-rays, MRI, CT scans. So there's no big deal about it. You see, laboratory investigations are supposed to be done in the context of a wellness check.
Wellness check?
At least twice a year.
Twice a year, okay.
So that helps you to check your body and to detect diseases early. Do you understand? Like, take for example, prostate screening, breast cancer screening,
even colon cancer.
Colon cancer screening, colonoscopy, cervical cancer screening. If it's done regularly as a when due, the problem is picked up early. Treatment will be directed to the problem early, and that will prolong the life of such person. Than for people to be running away from going to do a test because of the fear. It doesn't make any sense.
Let me ask you a question.
Yeah.
When was the last time a patient came to you and said, Dr. Jai, we're coming here to see how I'm doing? Last time?
The last time was yesterday.
Okay.
So
how often?
How often? Regularly. People come in because that is the in thing now. You need to check yourself. There are a lot of problems around that happens when you don't check yourself. Do you get what I'm saying? So it should be a culture in Nigeria to encourage people, to encourage Nigerians, encourage the citizens to go for a wellness check. It's extremely important.
Before you go, I know you have a busy day ahead of you. What is the future of healthcare in Nigeria and Africa? What do you see as the future?
The future of healthcare in Nigeria, it's, I would say, not too good. Why? Because most of our hospitals, most of our citizens go to general hospitals. They are not well funded. The doctors are leaving to better advanced nations because of bad pay, because of bad environment, because of poor remuneration, because of lack of facilities. You know, the environment is not conducive. So therefore, the citizens of Nigeria don't have a choice than to make what is available. Now, people that can afford private hospitals, they have to spend some money to get health care. So now, the people at the end of fear, they're supposed to sort this out, that have traveled around the world and not doing what they're supposed to do. So, it's a risk.
Very fragile.
Very fragile.
Thank you so much for joining the conversation on healthcare. Thank you for your service. I think conversations like this are important. They are needed, and when people hear from you as a practitioner, it's time for them to ask themselves, what can they do to make healthcare delivery more seamless? What can they do to ensure that you and I, regardless of age, background, education, gender, can have good, accessible, quality health? But also, how can we create a Nigeria whereby you falling sick doesn't destroy or stop your future? So thank you so much for weighing in. Pleasure talking to you, and thanks for the space.
Thank you very much.
Thank you so much for joining the conversation today on the need for good, quality public health. we all have a role to play in creating a strong health system. So do your part to make this happen. I'll see you soon.
I go make 'em. This year na my health. I go make 'em. With the right information. I go make 'em. Knowledge with the okay. I go make 'em. I no go no get it. I no go soon.